an opportunity to talk about autism. As we all know, April is a month of autism awareness. It's a perfect timing. This is a great platform. Awareness. I will start with some just background with autism and awareness. I was at United Nations on 1st April, and I really like that slogan. Autism awareness to action. Action. That's what is needed, and that's where this great talent is going to work on it and make it happen. We have a long way to go, and I would like to start with some brief overview of autism, and I will not get into more details. The experts and the Eden Autism Services and Nina has done a great job in presenting the video and the concept of some of the challenges faced by individuals on the spectrum, young to adult, and families. So as we know, there is every 9 minutes there is one case of autism diagnosed. So before I finish this presentation, there will be one more parent who will be told by the pediatrician that your child has autism, which is a big challenge. If you know any family, friends, I'm pretty sure you understand some of the challenges. And I would like to highlight some of the challenges and see what those serious challenges are. One of the key challenge where Eden and Nina and their team is working on is autism after 21. That's one of the big challenge. Employment. How do we keep them busy? How do we keep them employed? There is a 6% employment in the country. So every 100 individuals on the spectrum, there are only 6 people working with paid jobs. So we need to do a lot more training, a lot more awareness in the corporate world, where they will be welcoming, or we want them to welcome some of the high functional individuals on the spectrum and keep them engaged and employed. Some of the other things which you can just scan through, but I would like to focus on the challenges faced by parents. Now, if you are involved or if you are familiar with what parents they go through, this is the maze of autism. As a parent, you are working with schools, the therapists, the pediatricians, the healthcare professionals. It's a very complex and very busy day for a parent who has a child with autism. And this is, see, so far, education system, schools, special needs education schools, like autism, like Eden Autism Services, they were responsible for training and taking care of these individuals from 5 to 21. Now, that has changed. Now, recently, and thanks to Autism Speaks initiative, who has mandated insurance companies at the state level, where parents are now getting paid for therapy. It's up to $35,000 to $50,000 per year. So now there is a new component involved, where we have schools, we have healthcare professionals, and of course parents. They are putting their heart, they are putting their best efforts in training this individual. But this is what I have learned in last 7 years working with the autism community, that this is where the missing pieces or missing these gears are working independently, and this is one of the things which was presented to Verizon Powerful Answer competition, that this is what is happening right now in the autism community, and how we want to change it, and what we want to bring to the autism community utilizing mobile technology. It's a synchronized, holistic, and individualized intervention for individuals with autism. So we want to bring these stakeholders together and have them work together in a synchronized way. And if we can do that, we will get the best out of our efforts. So as one of the initiative in our toolkit, we call Colors Toolkit. One of the initiative is we are delivering intervention. So the child is going through the screening, and again in collaboration with Eden Autism Services, we have adopted their curriculum, and based on that we are doing the screening, based on after the screening and the assessment, we are delivering the intervention. And a typical setup, the way it works is you deliver the intervention with one-on-one. Next you go, the child is going to the kiosk or a tablet in the classroom as a supplemental reinforcer and supplemental intervention, and we are extending to homes, and then children with autism or individuals with autism can use the mobile technology anytime, anywhere. But the key is together. That's our slogan, anytime, anywhere, together. We all want to work together. There is this one child on the spectrum, but there are multiple entities involved with this child, and if we all can work together, that's what is going to make a real impact on the whole autism management. So as I have said, diagnosis is the key. Earlier the better, and this is I have learned from Dr. Michael Lewis from Robert Wood Johnson Hospital. We have adopted some of the theory and the screening mechanism, and we have built this app where parents can use this app at home. It's not a diagnosis, it's just a tool to capture the data, and it is going to give them, parents, an early indication of whether your child has some developmental delays or not, and go and see the pediatrician. Then next is the assessment kit, which is based on Eden's curriculum. So then you go through the assessment with simple questions, yes or no. We go through the series of questions and we set up the goals. And the last piece is we teach them using the mobile technology. And as we know, children with autism, they are visual learner. So they have seen the app and the animation, and individualized intervention is working out very well. Why not to use the technology, make it available to these children on the spectrum, and make that learning process a little bit faster and more intense. And these are the few collaborations we have done in the autism community in last several years, including some of the pediatricians in autism services. Also we have worked with, and we are working with one of the individuals who is on the spectrum. And these individuals, some individuals on the spectrum, they are very smart. They have very high IQ than some of the typical individuals. So we would love to work with them who is on the spectrum, take their entrepreneurship out and help them to make their ideas a solution. So that's what we've been doing. We have developed a lot of apps when we were developing our full package during last 7 years, which is about 575 skills. What we did was, as we were developing the smaller apps and educational program, we were putting that on the Google and Android, Google and iTunes stores. So that's how we have over 100 apps where we are getting a lot of downloads, about 1.2 million downloads in last 2 years. We are getting codes from parents from all over the world talking about how great the apps are working and the educational tools are working for their child. We are delivering about 5,000 intervention sessions every single day. We are delivering intervention to about 30,000 students all over the world, which is equivalent to having 35 full-time teachers. So just one server sitting in the data center is working. So we are not replacing, I want to make sure that we are not replacing any resources or teachers or therapists, because human touch is very important. So we are not replacing, we are just enhancing, and we are providing this tool to these experts. So our tool is based on the expert strategy and experts material provided by these experts. So it's just a tool to enhance the whole intervention process. And this is our vision. If you go back real quick, this is the dream. This is what we would like to make it happen. And this is where the real workforce, talent network will be needed in the state of New Jersey, and that's where the opportunity is. One of the challenge or the bad news is it's very expensive, rate has gone up, But the good news is there will be a lot of jobs in the state of New Jersey, because New Jersey has one of the highest rate in the country. So I think that's a great news for us, and we have a lot of great things to do. So this is one of the things which I would like to just reinforce and say, this is the opportunity. These are the few titles we have pulled out from some of the job portals, because that's my temporary staffing is my background. I have a core business, Random Consultants, who is in the temporary staffing business, and we see some great opportunity for young talent in the state of New Jersey. And thank you very much, and please spread the word autism awareness to the action. Action is needed, and for action we need some serious talent network in the state of New Jersey. Thank you very much, everyone.